So now you've graduated and you're becoming licensed as a registered nurse. What now? What kinds of things will be expected in the future, and what will your career development be like? This is a talk about a model by nurse Patricia Benner, and it's called the Novice to Expert model. And this will tell you what you can expect to happen in your nursing career for the next, at least the next 5 years. So Dr. Benner is a highly respected nurse with many publications. To my knowledge, she's still alive. She was trained at University of California, San Francisco. Had gone to Pasadena City College, and she has many publications that are coming up. So she's been awarded Living Legend in the American Academy of Nursing, a very prestigious award. Her books include From Novice to Expert, that's the title of this talk. Primacy of Caring, she has yet another, number 3 is also about caring, and 4 is about crisis and care. And her book 5 listed is Expertise in Nursing Practice. So there she's talking about judgment and ethics, and later on in your guidance center training we'll be talking about nursing ethics. And of course she's talking about caregiving. Nursing is the caring profession, so that's what we're most widely known for. Nursing, of course, was found this year, 2018, to still be the most trusted profession, 16 years in a row. So Dr. Benner is internationally known for her research and lecturing, and she's another tremendous honor, Royal College of Nursing in the United Kingdom. She's done nursing work in med-surg, emergency room, coronary care, intensive care, and home health. And she, as of the time of this recording, is researching the study of nursing practice in intensive care units and into the area of nursing ethics. This talk is about her primary model that she's most well known for, From Novice to Expert. This talk describes the stages of clinical competency. Now, early nursing theorists, like Dr. Benner, used other disciplines, the models from other disciplines, to develop their nursing theories, and that's so for other nursing theorists. Dr. Benner used the Dreyfus model of skill acquisition. I'm not too familiar with it, and it looks complicated. I really don't want to study it, but this is the model she used to develop her own theory. So in nursing, we talk about evidence-based. And Dr. Benner's research and her model and theory is evidence-based. In other words, she proved it. So in her original research, she had nurse preceptors, and you'll be assigned a nurse preceptor during your training, and nurse graduates, and experienced nurses, newly graduated nursing students, and she conducted interviews and did observations of clinical settings. So this is some naturalistic research, and she combined all this to create her nursing theory. And then there's another validation study with 190 adult health nursing students, wherein she observed the students in simulated rooms with mannequins. And the conclusion was about the development of nursing competence and clinical simulation. So she's an early theorist about the use of mannequins in early nursing training also. So how do we use her theory? Nursing school curriculum, many are built on Benner's model. clinical ladder is the progression of nursing through many stages, up until I have one employee now who's motivated to become DNP, Doctor of Nursing Practice. And this is information on how to develop mentorship programs. And we talked about clinical simulation protocols. That's really outside of this current talk. So each nursing theorist develops their own nursing theory. The Guidance Center is not necessarily dedicated to any individual nursing theory, and we'll just go through quickly her nursing theory. So she said there are four nursing domains, things that we should be concerned about. And you see that number 4, nursing, is just a part of her nursing theory. So first we're concerned about the person. That's mostly why people come into nursing. They want to help people in the course of their lives. The second is health. By Benner's definition, health is the absence of illness. Some other theorists talk about wellness as being just above the absence of illness and being improving in all of our biosocial, social, spiritual realms in a holistic manner. And we have to always evaluate, particularly in mental health, our clients in relation to their environment, their situations. Many will come to be hospitalized for mental illness due to psychosocial problems. They got kicked out of their apartment. They had an argument with their mother, father, wife, husband. They had a fight. And people without mental illness might handle it in a different way. The general coping for people with mental illness is to seek help in the mental health center. That's the best coping. Other coping strategies are suicide. My life is not going well, so I might as well kill myself. Homicide. Joe, Bill, or Bob is causing me a problem. I'll kill him and my life will be better. Drinking and drug use to suppress feelings and emotions. And some subpopulation does self-harm. Patients tell me it relieves their stress after they cut or abuse themselves. Doesn't work for me, but it seems to work for them. So, nursing is the caring relationship, and that is we go to school to help people or care for people. So we're talking about the lived experience of health, illness, and disease, and all people that are ill have a mental, emotional component to their disease, not just people hospitalized for primary mental health problems. So as a theorist that says Benner is relatively modern, she was born in 1942, so she's probably graduated. She's probably out of nursing school and practicing by 1964. So that's relatively recent considering many of the older nursing theories. So down to the details. Why are we talking about this? Benner said there are 5 levels: novice, advanced beginner, competent, proficient, and expert. And we're going to talk in a little detail about this. So you're starting now in the actual practice of nursing outside of school. And the first stage was school, novice. Person has no background or experience. Now, many people do enter nursing school with some background or experience. They've been a nurse's aide, a volunteer, a paramedic, and then they decide that they want to upgrade to become a registered nurse. So this is a student level. Everyone hearing this has exceeded the student level. So this is more on the novice. Inexperienced nursing function at the level of nursing school. And this would include, if you're a new graduate, you're in the transition now between novice to advanced beginner. So keeping in mind that she used the Dreyfus's theories, so the advanced beginner can demonstrate marginal acceptable performance. Having coped with enough real situations to note, or having been pointed out by a mentor, the recurring meaningful components of the situation. So we're using past experience and current mentoring to make clinical decisions. The nurse functioning at this level are guided by rules. So hospitals are full of policy books and rules. So the initial focus now is what is a hospital policy and what are the hospital rules and regulations that govern practice. Later we'll also be talking about the legal implications of nursing, what the Arizona Board of Registered Nursing expects for nurses to do. And we'll be talking more about nursing ethics from the American Nursing Association, and we'll be talking about standards for psychiatric nursing. So these will be in coming talks. So at this level, the nurse will still require mentorship or experienced nurses. And in the initial orientation, you'll be paired with an experienced nurse. If for any reason you should be alone and need assistance, the manager of the PAC, Sharon, is available by phone, and I am available by phone. And I can come into the hospital if needed. So in the beginning, mentoring will be individual, one-to-one. Later on in your career, if you're alone, you would be mentored by telephone. So you can expect this period to last 2 to 3 years to develop competence. That period of time where when situations occur, you feel reasonably competent to handle the situations without asking, seeking a mentor, asking a psychiatrist or other provider. So this is after 2 to 3 years. So don't expect too much of yourself right away. Proficient is in 3 to 5 years. The theory says you intuitively know how to handle situations. I don't think we intuitively know anything. We've learned from our past experiences, multiple, from similar patients that had similar presentations, and we know how we solve similar problems, what worked and what did not. So by proficient, you're no longer needing mentorship, and actually you're providing mentorship to new graduates and younger nurses. So this is a progression. The expert phase. Benner says 5 years. I think it's probably long. It was much longer than that for me. And by expert phase, people have a deep understanding. And by expert phase, a nurse is beginning to be affiliated in one way or another with research and beginning to do publications. So, and to do program design, program development, unit development, develop facilities, be a consultant for legal complications, and has a much wider scope than in the beginning. So this is a complicated matrix of everything we talked about. If you should like a copy of that, I have it. But this is really not much more than it is listed on the slides. Benner suggests a self-assessment at the beginning of training from, the transition from school to real nursing practice, And you'll be given this in your orientation to do a self-assessment of what you feel comfortable with and what you think your needs and deficiencies are, so we can work on all those things. So why is this important? One of the major themes right now, 2018, is aging out of nursing. Many nurses are retiring. Another thing that I see going on is nurses going on to advanced practice, leaving bedside nursing or basic psych nursing to become psychiatric nurse practitioner or family nurse practitioner. So we will continue to need to train new graduates for these positions. New graduates are the future of nursing, and this is one of the reasons that I've worked as a nursing instructor off and on throughout my entire career, and including while I'm working as director of nursing at the Guidance Center. So we must train nurses for the future and train them in a consistent manner and according to a training model. And this slide is what nursing leaders should do, people like in my position, to help address the shortage of nursing, develop specialty programs for graduate nurses, advocate for programs to increase confidence, and satisfaction of new RNs. Here at the Guidance Center, we have a monthly awards program and an annual awards program, and we also have in-service trainings. In-service trainings, the majority of them are videotaped to be on the hospital video wall. We're advised not to use novice nurses just coming out of school to fill staff shortages before the end of their orientation period. And we're advised to zero tolerance for violence or bullying. The Guidance Center is a very caring attitude to the nursing staff. So you will not find any violence or bullying going on here. If so, I want to know about it. And the nursing leaders are to provide support for nurses who are assisting, mentoring, and precepting new nurses.